Neonatal Abstinence Syndrome is the technical term for a newborn child who is born with an addiction. They're born with an addiction because their mother used and abused drugs while they were pregnant with them. So, NOS is a drug withdrawal symptoms just for babies, which is so sad to think about a child being born addicted to a drug and going through extreme withdrawals. The number one in the substances that are associated with NOS is opiates and opioids. The way that they affect the body and how addictive they are, that completely translates to the baby, and that baby becomes addicted, and once they're born, they need their drugs. Other substances are antidepressants, methamphetamines, and inhalants. Now we'll be discussing the various withdrawal symptoms that newborns experience. Some newborns can experience seizures, tremors, they can start to twitch, they have a high heart rate, they have a lot of muscle tension. Sometimes they have GI problems, so they'll be vomiting or have diarrhea. They might have a really hard time feeding and latching on. And what is the most notable and distinct and in every patient is a a, a high-pitched cry that goes on all day and all night because they're crying because they are no longer receiving the drugs from their mother anymore and they're in pain. And along with that comes irritability and inconsolability because they won't feel happy or good until they get their drugs because like a adult, they're addicted, unfortunately. So every NOS baby born experiences their withdrawals at their own sort of rate and time. Some experience it sooner than others, like some experience it after 2 days. Some start to experience it after 4 days. So after a few days, depending on what drug that their mother was on that had them on, that just that kind of defines when to expect the drug withdrawal process to start taking effect. So the severity of the symptoms and also the amount of time that it takes for those symptoms to activate really depends on a few different variables. It really depends on what type of drug that the mother was taking. Was it opiates? Was it antidepressants? Was it some form of a painkiller? It also depends on how much they were using, the amount and dose, and also for how long were they taking it. Were they taking it the entire pregnancy? Were they taking it only during a certain trimester? And it also depends on what the mother's body is, how their body breaks down that drug, and also how their infant breaks down that drug and their infant's metabolism and how they secrete that drug. That can all have an effect on the way that the withdrawal symptoms play out. In terms of testing, there's a few different ways that we can figure out if the baby has NOS or not, and one of them is to check the urine or meconium samples for drugs. Another way is through using the phennogram scoring system. So this uses every symptom that I named off and more, and it basically there is a depending on the severity of it that translates to the score, and then once that's all tallied up, you could see how severe their symptoms are, and depending on that, that defines whether or not they can be diagnosed with NOS. And scoring is really helpful for initiating and monitoring the baby and also for determining what their treatment plan is going to be. So, treatment is based off of the Finnegan score and the severity of their symptoms. In every single case, the doctors are always going to want to try the non pharmacological route first. And so, for instances of the NAS babies, the non pharmacological route means trying to bring the baby as much comfort as possible. So that means swaddling them, keeping them tight, and holding them. Also, having them in really dimly lit rooms, and also having the rooms be very quiet because any little noise can upset and disrupt the baby because what they're going through is very serious. You have to think about it as if it is a full adult going into a withdrawal, but it is just a little baby and they don't know how to comfort themselves. So, another way to help them out this way is through giving them IV fluids. IV fluids will help them to become hydrated because they can go through GI problems and start to vomit a lot and have diarrhea. And the non pharmacological route is what ends up not working most of the time. So, because of that, most babies aren't responsive to the non pharmacological route because their bodies are so used to taking drugs that they need something to supplement. They can't go without, they can't go cold turkey, or else they have the risk of dying. And so, in cases of NAS babies who are addicted to opioids, they give them two of the best drugs that they can give them to help to wean them off, which has been clinically proven, which is methadone and morphine. Now they're giving these in very small amounts, like 1%, 1 milligram, and the dose depends on whatever their weight is. And also some other drugs that have been proven to be really helpful with NOS babies are buprenorphine, phenobarbital, and clonidine. Those are all have been proven to be effective with taking some of those withdrawal symptoms down and eventually weaning them all off of all drugs. Now, the doses and the amounts aren't really perfect. Right now, we do not have a perfect system. There isn't enough research and studies to figure out what is the exact perfect drug or the perfect amount. And so I think in the coming up years, there'll be more information about what is best. But we have to remember every person is different, every body reacts differently. So what has been proven to be really effective is the methadone for heroin users and other opiate withdrawals. In terms of taking the baby home after being born with a neonatal abstinence response, it's going to take a while for them to get back home. They have to become stabilized. Their withdrawal symptoms have to be diminished, and they can only really go home once they are healthy, they're feeding well, they're sleeping, they're starting to gain weight, and only then will they be able to get a new Finnegan score. And depending on what the condition of the child is, that determines whether or not they can even go home if they're healthy enough. And once that baby goes home, the health issues don't stop because they're going to be needing constant monitoring for the next 10 to 15 years. They have to be monitored because they may have some form of a disability, they may have some form of a disease that can't really be seen right away. So, over the course of their life, they're going to have to continuously be monitored and be very conscious of what they're putting in their body so that they don't become addicted again like they were whenever they were born. In a study done by the CDC, they found that children with NAS have the potential to have mental, cognitive, and educational disabilities. So they might have a delay in their speech development. They may have some form of language impairment or speech impairment. They might possibly need speech therapy, and also they could have a lot of different learning challenges in not just their childhood but throughout their life. And are their longer term effects that they're studying currently, but these were just some of their findings that children with NAS are most likely to have all sorts of disabilities that we don't fully know about yet or understand yet because there hasn't been enough time or research put in to do a long-term study, but they're on their way and they're coming within the next few years. There'll be more information on this. In 2012, the National Institute on Drug Abuse released a statement saying every 25 minutes a baby is now being born suffering from an opioid withdrawal. Now, we all know that there's an opioid epidemic going on in America, but what we don't know about and we don't hear about as often is the maternal opioid use that is going on and how that is affecting the kids who are supposed to be our future. And it is estimated that in 2012 there was almost 22,000 babies who were born with neonatal abstinence syndrome, which opioids are one of the main drugs that causes neonatal abstinence syndrome. So that number is just increasing and increasing. And I believe that the National Institute on Drug Abuse is actually conducting a study going on right now, which we don't have the findings for yet, but there's still so much that we have to learn about neonatal abstinence syndrome that we need to take the time to fully understand what is the best treatment, how should we be, oh, what are the better ways to avoid this? Is there anything that we can be doing to decrease the rate of babies being born with suffering withdrawal symptoms like this? There has to be a better way. Like, it's not a perfect system right now that's in place, but we are working our way towards finding out what works best and what is going to truly help change this. Because this is an epidemic that we aren't really hearing about and aren't talking about. Neonatal abstinence syndrome babies, these babies are the silent victims of the opioid epidemic. And although it isn't a perfect system, what is in place right now is actually helping a lot of babies, but there isn't enough long-term studies to truly know the effects that neonatal abstinence syndrome has.